Hey, Nami Sue, it's Mr. Yance again. We're going to finish up notes today. Our test will be Tuesday. So I just got 3 slides of notes. That way you'll have them over the weekend. And then I'll show you what diagrams are on that test Tuesday as well today. So this will kind of wrap up the joint chapter. And then we'll probably have just one more chapter. And that'll be the end of the trimester, believe it or not. So we talked yesterday about types of joints according to are they angular movements, circular, special, whatever. Today we're going to look at them based on how many planes they move on. Okay, these are super simple. So you got uniaxial. Uni means one, right? So a hinge joint, your fingers, they hinge, right? Not your thumb, but your 4 fingers. Okay, your elbow, okay, your knee. Those are hinge joints. They're moving on one plane or one axis. Okay, a pivot joint is a little more um, complicated as far as a uniaxial because you have to be careful what you're talking about. We're not talking about the head because that's a biaxial joint. We're talking about the neck. Okay, the neck will move on one plane. Okay, that we're just talking about those cervical um, vertebrae and the ulna and the radius. Okay, lower arm one plane. Biaxial means 2 planes or axes, plural. Think of your thumb, very, very unique thing to humans. We can touch our 4 fingers with our thumb. That's called a saddle joint, and it moves on 2 different planes. It allows us to grip things. And then the condyloid ellipsoidal, fancy word for wrist, your neck or your head, yes, no, okay, 2 planes, all right? Pretty basic, 1 plane, 2 plane. And then the ones that we injure the most and the ones that we've talked a lot about is the hip and the shoulder. A lot of replacement things are done there because they move on lots of planes. You got a ball in a socket, good test question, most movable joint in the body. And that ball and socket allows us to pivot and turn and move multiple directions, okay? And then your gliding joints. They don't move a lot, but think about your lower back, your middle back. We can twist and turn and move our spine in different directions, all right? So that's pretty simple. I don't want to spend a ton of time on them. Just remember uni 1, axle is 2 planes, and then multi is multiple, 3 or more, okay? Last 2 slides I think are very, very important because a lot of people deal with these things, and that's arthritis. You hear the term arthritis, you see a lot of commercials on TV about it. A lot of people, when you get to certain ages, you're going to deal with arthritis. And there's different types of arthritis. Osteoarthritis is probably the most common. That's when the articular cartilage, and this is what I got going on in my knee. I got little fuzzy things on my knee. Supposed to look like a nice smooth cue ball. It's not. I deal with pain in my knee all the time. And what happens is it grinds. So as it gets thin, you start getting bone on bone. And then a lot of times it'll get to a point where you can't move it at all. Okay, so let me show you a couple pictures here. So osteoarthritis is a very common problem. Then we're talking about this caps on the bones. You see this white stuff right here. That's what it's supposed to look like. Unfortunately, sometimes it starts to get pretty bad, and you can see it really well with this picture right here. You can see how it gets jagged and thin. It's supposed to be nice and white and smooth. It's not. Okay. And here's one that's really, really bad. This is progressed way further than it should, and you can see how rough that would be and how much pain that would cause, right? Okay, so that's the most common one. A lot of people deal with that all the time. There's medications and things we can do to help that, but if it gets really bad, you're going to have replacement things put in. That's just pretty common. I showed you some of that with some of the other videos. Another type of arthritis is rheumatoid. You see that a lot, commercials on TV as well. Very disabling, a little bit different. It's not the articular cartilage that's affected, it's the synovial membranes that surround the joint. They get inflamed, and when they get inflamed, they're going to cause something called synovitis, which is a very painful condition. If it's not taken care of, usually after the age of 40s, 50s, in that range, you can get this granulation tissue called pannus. I'm going to show you a pretty gross picture here. And think about throwing sandpaper in your bones, how painful that would be, right? Or gravel or sand. I think sand is probably a good example of that. You can get some really nasty things with this one. So let me show you. Now, again, I'm showing you the most extreme of the extreme, all right? So this is what happens. You get very disfigured. You see all the inflammation in there. And then if it gets really, really bad, this would be pannus. Now, that's pretty nasty. That's the big toe. But you can see what it does. It just causes a rough surface. And then what happens is, especially a lot older people, they just quit moving that joint. It hurts so much to move the joints that they quit moving, and then they get fixed. Their fingers get disfigured and they get fixed in place because fibrous tissue grows. So that's why it's very important to get on top of this quickly so that they don't progress to this stuff and causes a lot of problems with that. Okay. And then the last one is called gout, gouty arthritis. It's kind of an indirect affection of the affects the joints. This sounds kind of gross, but it's actually sodium urate crystals, which is a solid form of urine. And it crystallizes. And again, think about how painful this would be. Good test question is it's influenced by three things. So get this down: diet, genetics, and alcohol. You can't do much about genetics, but we can limit what we eat and we can be careful, drinking alcohol. So, that is one that is easily treatable. You can use, there are a lot of medications for that. Just watch what you eat. Cranberry juice, believe it or not, is a really good one. And gout can just get really, really nasty. Let me show you some pictures of this. And usually it gets in the big toe because it accumulates in places of low circulation. And you can see what I'm talking about, how inflamed that is. Look how bad that is. So it's pushing that big toe inward. This is pretty extreme. All these are. It can get many of the fingers and toes it affects the most. That's this nasty stuff. And that's what it looks like under a microscope. You can see how painful that would be. All right. Okay, that's it for notes. So please look those over. Hopefully you've watched all these videos. We'll have a test Tuesday, just like we've been doing, a big Google form test, mainly multiple choice matching, and then like we've done before. And I have 3 diagrams. So your collar sheets, and I'll put these notes online today. There's 3 pictures you need to study, and I even label what letters you have to study. So I'm trying to be nice. This is all on plate 1 or plate 39, just one page you have to study. All 3 of these pictures are on the same collar sheet. Okay, it's actually the last page of your collar sheet. Don't worry about the other 2. All right. So we're going to look at the top picture of the knee. We talked a lot about the knee, A, B, C, D, and F. And some of these will be used more than once. So I'll have separate, those grid things where you just fill in the bubble, what goes with it. So that's going to be the articular cartilage, the synovial fluid cavity, synovial cavity, the joint capsule, and then bursa, and then F is lateral meniscus. Okay, so just study those 5 things. That'll be the 5 will be on that diagram. This is the middle picture. We're going to have some of the same ones again. There's E again. I guess E for the first time. E and E prime, those are your anterior and posterior cruciates, very big ones. And then lateral and medial meniscus, don't get those backwards. That's F and F prime. And then G will be the patellar ligament. And then we're going to look at this picture. There's E and E prime again. So you got the posterior and cruciates and anterior cruciate. Something new this time. This will be H, the tibial and fibular collaterals. H and H prime. And F prime would be the medial meniscus. Okay. So just study those 5 things on each of these 3 diagrams. They will be on the test along with your note questions. And we'll get that test in Tuesday, and then you can have a nice fall break, and we'll be good to go. Okay. I'll have something on there tomorrow for e-learning, probably be a video for you to watch and do a little video review, nothing major. And then we'll do a review thing on Monday. I'll put online a little Kahoot. And then Tuesday, we'll take our test. So I'll send you a password like I've done in the past. Hopefully I see you guys all on can't even think of the name of it. The Google, you know what I'm talking about. I don't know why I'm having a mental block, but Google Meets. There you go. See you on Google Meets tomorrow. Same time, same place, 12:30. Hopefully you'll tune in. I'll talk to you. So if you got questions, you can ask me. All right. Hey, have a great day. That's it for notes. So we'll take tests on Tuesday. All right. See you. Bye.